Good day everyone, this is Angela Dominic C. Policarpio, nursing student from Davao Doctors College. So today I am going to perform the oxygen therapy, and this method is used to oxygen supplementation at the higher percentages than what is available in the atmospheric air. There are two sources of therapeutic oxygens. We have the wall outlet, which we can usually found in Davao Doctors Hospital, and lastly is the common one, which is the oxygen tank or cylinders. So there are three main purposes for this intervention. First is we have to relieve the dyspnea or difficulty of breathing. Second is to reduce or prevent hypoxemia or hypoxia. Lastly is to alleviate associated with struggle to breathe. So first, we are going to prepare the materials that we are going to use in this intervention. So this is to save time and effort. We have here the humidifier, as well as the flow meter, the patient charts or the record, gloves, adhesive tape, the nasal oxygen cannula, sterile gauge, and our oxygen cylinder. So next, we are going to determine the need for the oxygen therapy and verifies the order for the therapy. This is to verifies the order and as well avoid the medical errors. So I have here the patient information or the patient chart. Okay. So in this chart, we are going to determine whether the patient needs oxygen therapy. So today I have a patient named Jane, female, ages 21 years old, in room 301B. Upon arrival, she complains of dyspnea or difficulty of breathing. She is under the supervision of Dr. Takdoro, and her vital signs, BP 140 over 100 millimeters per mercury, is considered as hypertensive. PR or the pulse rate is 110 beats per minute, which is tachycardic. RR or respiratory rate is 35 cycles per minute, which is considered as tachypneic. And the temperature 37 degrees Celsius, while the O2 sat is 90%. So based on the doctor's order, on August 16, 2021, Monday at 9:30 a.m., Dr. Takdoro has ordered O2 inhalation at 2 liters per minute with 26% oxygen concentration via nasal cannula with continuous duration. Given that our patient has difficulty of breathing, since nasal cannula is more convenient, comfortable more than face mask, brings less anxiety, allows client to eat and talk, mouth breathing does not affect the concentration of the delivered oxygen. So next is perform a respiratory assessment to develop baseline data if not already available. This is to obtain baseline data that we can compare later on to see if there are any improvements to our patient's conditions. And since we done this earlier, I will now going to proceed. So before proceeding to the client's room, we should post here first the warning sign that I will be going to explain later on. Hi ma'am, I am your student nurse for today. How are you feeling right now, ma'am?
Naglisod gyapon kog hawa.
So next is we're going to prepare the clients and as well as the supporting system or people. We will be going to assist the client into a semi-Fowler's position if possible, because this position facilitates optimal lung expansion. Ma'am, i-adjust na to imong bed ha.
Oo.
explain that oxygen is not dangerous when safety precautions are being observed. So, oxygen gas will not just explode. It will just cause fire when being exposed to lighting materials. So, ma'am, kay si Ma'am Jane Mandere, kay nagamit aning oxygen cylinder. So, mag-beware lang ka ani na sign, ma'am, kani o kana. So, ang pasabot ana kay dapat way maggamit og sigarilyo, way mga posporo or unsa ba na source og kuan kanang murag kayo kay kuan magud mo support magud siya og combustion, which is kanang mukuan siya ba kanang dali ra siya mo adapt og kanang kayo. So ilikayan ang ato ning paggamit sa ana. Pero dili mo magkabala ka kay ang kaning oxygen tank dili man buto pag ma-expose sa kayo. Makuan lang siya, mo cause lang siya or magkasunog lang siya. So inform the client and the supporting people about the safety precautions connected with the oxygen use. Prior to perform the procedure, introduce self and verify the client's identity using the agency protocol. This is to establish rapport to the patient and also verify if our service has been administered to the correct patient. Maayong buntag, ma'am. Ako ay si Administration-Policarpio, imong student nurse karon gikan sa Davao Doctors College. Pwede ko makutanong sa imong pangalan, ma'am?
Jane Diaz.
Yung birth date, ma'am?
September 3, 2000.
Okay, salamat. Is explain the client what you are going to do, why is it necessary, and how he or she can participate. So this is to reduce the client's anxiety and also gains or promote cooperation with the patient. So, ano tayo, ma'am? Nagdala ko og nasal cannula, sterile gauge swab og adhesive tape kay ngano, ma'am, katagan ti ka og or mo-undergo ka og oxygen therapy kanang ni-prescribe na sa doktor na mag-auto inhalation ka kay para maitama na to ang imuhang kakulangon sa oxygen. Kay nagreklamo man ka, ma'am, na maglisod ka ginhawa, so kani ang atong best na way para ka makaginhawa o para dili ka makulangan og oxygen sa imong lawas. Now, let us discuss how the effects of oxygen therapy will be used in planning care or treatments. And by this results to reduce clients' anxiety and for us to acquire the patient's trust. Ang oxygen, ma'am, kay tambal sa imuha aron makaginhawa ka, ma-relax ka o aron dili tud ka magka-kompromisyon na pariha sa hypoxia or ang kakulangon og oxygen sa imuhang cells or tissues nga kini kay delikado o atong ginalikayan na mahitabo sa imuha. So before we begin, let us first perform hand hygiene and observe other appropriate infection prevention procedure. This is to deter the spread of microorganisms. And now I am going to use the alcohol to disinfect my hands. And I have also here my gloves. This is for me to prevent or avoid harboring any microorganisms. Isirado na komportahan, ha? So now we are going to provide the client's privacy. This is to protect the client's integrity. Next is setting up the oxygen equipment and the humidifier. So this is our humidifier attaches with our flow meters. So now we are going to connect the flow meters to our oxygen tank. I already attaches the flow meter to the oxygen tank. The flow meter should be in the off position. So the oxygen flow meter used to regulate the flow of our oxygen and oxygen humidification. So if the oxygen flow meter is found to be open or on, it will be dangerous because it can cause fire inside the hospital. If needed, fills the humidifier with sterile water and attaches the humidifier at the base of our flow meter. So here is our flow meter and this is its base and this is our humidifier bottle. So I've already filled this with sterile water with the line provided in the humidifier bottle. So we need this humidification or humidifier bottle because it will prevent the drying of of the patient's nasal mucosa. Then connect the tubing onto our humidifier or flow meters. So now it is connected. So for us to be able to identify whether the gas is already or is present, we can check it by feeling it with our back of our hands or our skin. So next, we will be going to turn on the oxygen at the prescribed rate and ensure proper functioning. So check the oxygen is flowing freely through the tubing. So make sure that the tubing is patent at all times and the equipment is working properly. So this is to ensure that the right service is being administered to the patient and prevent medical error. So now we are going to set the oxygen at the flow rate or DIRD. So the patient was being ordered to have a 2 liters per minute with a 26% oxygen concentration with a continuous duration. So I will be going to set the flow meter into 2 liters per minute. So now I already set the flow rate, which is 2 liters per minute, and also I have already set the oxygen concentration to 26% and with a continuous duration. So the elevated levels of oxygen in the patient's body can depress the stimulus to breathe. So next that we are going to do is the application of the appropriate oxygen delivery device. So this way is to put the cannula over the client's face with the outlet prongs fitting into the nares or nares and the tubings hooked around the ears. So proper positions allows unobstructed oxygen flows and eases the client's respiration. Check for the tube patencies. So, but before that, let's double check the tube patencies by using the back of our hands. This is to assure that the air or oxygen gas is ready to administer. Ma'am, itawag na nako ang nasal cannula sa imong ilong ha. Ma'am, ingna ko ma'am ha kung dili ka komportable or sakit or unsa.
If the cannula will not stay in place, tapes it at the side of the face. This is to secure the tube or cannula, especially the prongs inside the nares, to prevent dislodge.
This is for us to secure the tube and also to prevent the tube from being dislodged. So using this sterile gauge swab, we can pad the tubing and band over the ears and cheekbones if needed. So this is to prevent irritations because frictions may happen on that area like in the ears or in the cheeks in any minute. So we can prevent or avoid that to cause irritations. So after everything that we have done, we should never forget to reassess the patient after the interventions. So we can assess the patient through her vital signs, level of anxiety, color, ease of respiration, and provides support while the clients adjust to the devices.
Assess the client in 15 to 30 minutes depending on the client's condition. Observe the patient with her breathing and comfortability.
So, for the assessment for the nasal cannula, we are going to assess the client's nares for incrustations and irritation. So, this is to ensure that there are no blockage of the gas to be inhaled and to prevent alterations. And since the prongs are being attached to the nares, sometimes it could cause irritations, and it should be prevented to avoid further complications. So, we can prevent this by applying a water-soluble lubricant as required to suit the mucous membranes. So, frictions may be rampant in this area, like the nares. A water-soluble lubricant can be useful to prevent irritations in this area. And we should also assess the top of the client's ears for any signs of irritations from the tubing. So, if present, padding with a gauge pad may help relieve the discomfort. So, we will going to assess or inspect for the ears as well as for the nose for any signs of incrustations and irritations. So we already put gauge pads to the ears side to prevent any frictions or irritations to occur in this area. Next that we are going to do is to inspect the equipment on a regular basis. So check the liter flow and the level of water in the humidifier in 30 minutes and whenever providing care to the client. So we can refill the humidifier with sterile water if it's necessary, because oxygen therapy can easily dry the mucous membranes. Next thing we're going to do is to make sure the safety precautions are being followed. So we can check whether the patients and the support systems understand the warning signs by observing the things on their table, or if there are presence of lighting materials or source. So next we will be going to do the hand washing or hand hygiene, and also to do the aftercare. So first, I am going to remove or undo my gloves and dispose it properly. And now I am going to put some ethyl alcohol to disinfect my hands and observe other appropriate infection prevention procedure. This is to deter the spread of microorganisms and to prevent harboring it. So by doing the aftercare, we can have an organizations in the patient room and or her bedside table. So lastly, we are going to document findings in the client's record using forms or checklists supplemented by narrative notes, but when appropriate. So interventions without documentations is considered undone. So this will serve as your basis in further assessments or interventions.